So I want to ask you about cognitive behavioral therapy because I feel like that's a hot topic that's always being debated in the field, and it's got like multiple angles. So your CBT people are saying this is where all the evidence is. This is the most evidence-based, form of therapy. Your psychodynamic and psychoanalytic people say it's shallow. You're not really getting the full depth of the human experience, so you're not really getting a core change in the person. And kind of your social justice perspective is that CBT is like gaslighting the client. So what do you think about CBT?
I don't know. I mean, CBT is just yet another tool. I think that my concern is who is the person that is using the CBT and how are they using it? Because let's talk about it like a thought record, right? So a classic tool, or even like Socratic questioning, is a classic tool in CBT. And so you could be a psychodynamically minded practitioner who is aware of your countertransference and the patient's transference behaviors and feelings, and still do Socratic questioning and achieve something deeper than just challenging their core negative belief.
There's a philosophical element to CBT, which could be summed up as, tell me what you believe and tell me why you believe it. Now, that's quite philosophical, but people seem to have lost that. They talk about their beliefs as if they're facts because the people they're following or the people that are leading them or whatever it is, whatever ideology or cult or group or movement, whatever it is they're involved with, is telling them this is the narrative. And the thought of challenging that narrative, losing that narrative, well, they might be expelled, they might be treated like the enemy, they might lose their connection. And all of these things are terrifying for people.
And I know in my program, CBT is almost like, it's like, well, I'm going to treat the client by physically abusing them or something. I mean, that's how it's kind of conceptualized. Gaslighting would probably be the most common word you'd hear to describe CBT. I've heard in my classes that you cannot use CBT on a racial minority because rationality is racist and rationality is anti-Black. I've heard that. And I'm wondering how you have heard people talk about CBT in your program.
I think people, I've definitely heard just sort of discussed. I don't know if I've seen what you're describing where it's like you can't do it or practice it on racial minorities or things like that. But I think most people consider it to be like superficial, masculine, overly rational, and it's not going to work. You need a true heart change, like a conversion, like a conversion to whatever, kind of in a religious sense. And I think CBT is too on the surface for people, which I think for me, CBT, first of all, it targets all these different aspects and it gives you the option of being able to, if somebody has a behavioral challenge or a thinking challenge, you can kind of target it in a way where it's going to, have a knock-on effect on other things. But it also gets into these core schemas, which I think goes way beyond just superficial. I think people think it's like putting a Band-Aid on a problem, but I haven't seen what you're describing.
What you see or seeing in the field with how people view CBT, because it's got a tremendous amount of evidence, behind it, and it's got a fascinating philosophical history with Stoicism and that kind of, mentality, bringing that into the theory. In my program, we haven't even covered, not even once, CBT, other than kind of offhanded comments like why it's, only for white men or, CBT is racist or something like that. Even in my theories of counseling class, we just skip CBT. So, I mean, it's definitely not in favor where I am. I'm wondering what you're saying.
I don't even know how you would do that. I get that. I mean, I do. Things come in and out of popularity. I get that.
I feel like it is definitely good to have an injection of women and femininity into the field, because there was probably certain aspects of empathy that we were missing in this field, and I think it's become so skewed in one direction that, like you said, we've kind of missed out on certain masculine elements like that rational side of things, and even kind of, from my perspective, pushing a little bit onto the rational side. Even if it doesn't make you look bad, it certainly makes you look suspect. What is this white man trying to do with the CBT,
Gosh, I think everyone sort of hates CBT. I think slightly for that reason. I had a great CBT professor who I literally I watched him convert all of these anti-CBT people to CBT because he was really got into the meat of it and isn't just I think people have sort of a misperception about it's just about thoughts and nothing else, and it's really shallow and hyper rational in that kind of way.
It seems to me that CBT is so like it's so grounding and it's so simple presentation, but hard to master. I always kind of tell
Mm,
people it's kind of like playing chess. Like the rules of chess are not hard, but mastering takes you a lifetime.
mm.
So I think maybe this is a twofold thing. Maybe they're not doing CBT or they're trying to avoid it just because it is complex and but they don't know the complexity of it. They just know the simple presentation of it. So it's like, oh, that's just, it's overly simple, or it's just, oh, just suck it up and move on, but that's not all it is.
So the primary criticism of CBT in your program is that they would say it's not effective rather than it's immoral.
Yeah, and I think they would also characterize it as like part of, the sort of like medicalized model. And like
Gotcha. Okay.
people really don't like the medical model and it's all like
Yeah.
holistic and stuff like that. Which I get that, but like I'm somewhat uncomfortable with like holism in certain things. I think it like kind of lacks boundaries and like specificity. And I think like if we're going to be doing things like billing insurance and diagnosing, then like we also can't have it both ways.
Yeah. Yeah, I think that's part of it, but I think there's more to it as well. One, if you're going to practice CBT, you have to acknowledge that objective reality is a real thing. If you're going to see something as like a cognitive distortion or view it as illogical, there has to be some reality that you're comparing it to, right?
Correct. Yeah.
And the other thing is CBT really kind of asks people to take personal responsibility for their actions in their life, and that in itself is seen as offensive.
Uh-huh. Yeah. Yeah, you're completely correct. So, and what I honestly don't understand, and when I get into conversations, and I hope it comes across that I can hang with both crowds. Like I get where the non-CBT people, I get where they live, and I can even hang with, I can hang with both crowds. But what I don't understand is not just working with your client where they are. So you were talking about there is realities and there are standards and there are things. All you have to do is say that out loud, and that I'm not saying that this is your perfect world or this is the way that things quote unquote should or should not be, but there is a norm. There is a standard. There is something that you can look at that's worked for 2,000 years that hasn't been questioned, a great deal. So let's go with that. Once we kind of get, you have to know the rules before you break them. You've heard that phrase. And,
Yeah.
so what's the rule? What's the standard? What's the norm?
What I see a lot in the mental health field is this type of kind of rational, maybe CBT type analysis would be gaslighting the client. Have you heard that criticism?
I've seen that online. I mean, thankfully, I don't see that a lot in terms of therapists I happen to work with regularly. But yeah, I do see that online. I mean, I think to call it gaslighting, I mean, it's such a poor characterization of what's going on. Because it's really not gaslighting. It's, you're giving the patient legitimate tools. Either you're giving them tools or you're helping them find the tools within themselves. And these are things that if they practice them and use them successfully, they will see results from that. Because gaslighting implies that you're lying to them, you're tricking them, what have you. But that's not what's going on here. If anything, the opposite. We're acknowledging the reality. So yeah, we might say, hey, the world feels scary right now. There's a lot of uncertainty. You're very happy with what you're seeing, so you don't deny that. But what you do is you say, okay, well, yes, that's happening, but sort of what can we do to help you make progress? What can we do to help you? What can we do to help you reduce your anxiety? So I would not see that as being gaslighting. And then the other thing I would say would be, well, what's the alternative that you're recommending? In essence, are you suggesting that we tell patients the world sucks? You're powerless. There's nothing you can do about it. That's not very therapeutic. That's not helping the patient. So I would reject that characterization of these CBT-based interventions as gaslighting.
Yeah, I'm not sure if you're familiar with Greg Lukianoff.
Yeah, that's funny. I was actually going to mention him at some point.
Yeah, he describes a lot of this type of mentality as reverse CBT, like kind of anti-therapy in a sense.
Exactly. Yeah, I mean, it truly is. It's sort of like you take every main principle of CBT and you invert it. And that's what you get. You get this large mass of people who they feel powerless, they feel helpless, they chronically experience themselves as being victims. They see every sort of word and thought that they disagree with as being violence. That is not therapeutic. And that's sort of a recipe for creating a whole mass of Americans who are going to be chronically anxious.
There's a number of psychoanalysts that I follow that I really respect and enjoy who make this case of, CBT is all, part of this medical model. It's just because insurance companies want to get you in and out in 12 weeks and all this kind of stuff. And I think there's some truth to that. But I think the other side of that puzzle is most people don't want to be going to therapy multiple times a week for 5 years. A lot of people, if I can get in and out in 12 weeks, I'd prefer that, So I think CBT actually meets people's wants and needs better in some ways.
Yeah, and I think it's useful for us to remember that not everything is our problem. I think when you're dealing with mental health or when you're dealing with a person in this kind of capacity, there's so much there. There's almost nothing off limits if you don't you have to be mindful of the fact that there's almost nothing off limits if you approach it from a fully holistic perspective where it could be mind, body, their relationships. There's at a certain point it crosses a line to where there are no boundaries. And so I think things like CBT also just they don't have maybe a specific telos of inserting what is the meaning of life. This is what you should be thinking, and this sort of transformational religious conversion. It kind of meets people where they are, and it doesn't go outside of its the boundaries of what they're there for, because I don't think people necessarily come to therapy to be converted into some kind of religious perspective.
I think a charitable interpretation of CBT would say that, there's behavior and mental blocks that you have, and the therapist is just there to help you remove those blocks, and then you have that kind of big heart change on your own after that blockage is removed.
Mm-hmm. Yeah, I think that's a good way of putting it.
Well, you don't like CBT from what I understand. Hold on. I see some of the things that you say, and I think I understand where you're coming from, but for years before I started seeing clients, I would read tons and tons of books, and CBT is where all the evidence is, and it seems so practical, so logical. And probably about 10 minutes into seeing my first client, I realized, wow, there's a lot of issues under the surface that my little bag of tricks cannot touch. So tell me what you think of CBT.
So I want to be very fair to how broad that term is. CBT encompasses a lot of great theorists and a lot of less great theorists. Typically, when I refer to CBT, I'm talking about second wave CBT, primarily Aaron Beck, the cognitive therapist who tried to really integrate behavioral principles and reconceptualize ego psychology into something that's very practical. Now, his theories aren't awful. I really like, some of the cognitive distortions. It's a great introduction. You can give someone a sheet of all the cognitive distortions and they can read through it and they'll be like, this one's me, this one's me. Oh, I learned very much about myself. But the spirit of CBT, I think, is what really ruined the profession. The spirit of it being, let's break therapy down to its smallest point and let's more or less brand it. And branded psychotherapy has kind of created this typically 12-week model that follows a very rigid structure, week 1, week 2, week 3, week 4. And it is replicable, and therefore it's very easy to study in research settings. And so you can compare it to other CBT 12-week models. You can't compare it to somebody who maybe comes to therapy with borderline personality disorder and they're in therapy for 4 years. There is no way to measure reliably the exact same treatment because there is no such thing as the exact same treatment. No more is there such a thing as two exact same people. But CBT, at least the spirit of CBT, tries to capture something that can be replicable and provided generally. What ends up happening is it makes the therapist themselves the most replaceable person in the equation. If you're doing, let's say it's CBTD for depression, you're on week 4 of CBTD and you move and you go to another person who practices CBTD, you can start up again on week 5 and continue through the protocol. There is a lot that's missed from that. At that point, it may as well just be a self-help book.
Mm. So
AI can do that.
would you say, if we're mapping this onto kind of like a psychoanalytic brain, the ego is corresponds with CBT and the id corresponds with psychoanalytic or dynamic?
I would say that. I mean, the ego definitely is more of the logic based, trying, for sure. So the adult brain, 100%. Exactly. So again, so if the id is running wild, or if the super ego is so harsh, okay, again, where it's just building that, or it's just infusing you with so much shame, right? How do we overcome that? How do we get past that in order to access that, the ego base, or the CBT approach?
It sounds like at least part of your criticism with like the various different waves of second and third wave CBT is that it's shallow. Like when I think of distress tolerance skills with DBT, I think of a really good band-aid, right? But not necessarily treating the deeper wound. But like it does kind of treat the stuff on the surface in a way. I'm wondering, like with some of the stuff with CBT, does it point you to the deeper things that psychodynamic deals with? Like with CBT, you kind of peel back some of the layers of the onion and then you say, okay, here's your core belief underneath. But CBT doesn't really do anything once you discover the core belief. Could you start with CBT and then, once it's fleshed out, really bring in the psychodynamic? Does that make any sense at all?
I think that would be a great start to therapy. Honestly, I think radical behaviorism, just like pure like Skinnerian behaviorism, where people say, I have this symptom or I have this specific goal. Great. Here is 3 months of focused effort on you achieving that goal. And you work at it, you chip away at it. You maybe get rid of a single symptom, or you develop one specific skill. Maybe you even achieve that goal, which is awesome. Then most of the time people realize that doesn't solve all of my problems. In fact, that actually revealed a whole slew of other issues. Then therapy can begin because we have addressed that surface. We have addressed the symptom. Now we can address what's underneath the symptom. Now we can address what's underneath that. CBT can do that. The spirit of CBT, again, which is very often a very rigid, specific, in settings where that works, they often have really long wait lists. So if you gave them more time to use some of those skills, it might look a little bit more psychodynamic. Maybe you can get into some of those deeper, more unconscious variables. But very often it's like, no, you've had your episode of therapy, go off and like do that. Make room for other people who haven't even had their first dose. And I get that. I understand that.
Gotcha.
Once the book is closed, good luck.
I followed this one psychoanalyst who said, I could teach a chimpanzee to administer CBT. And then you've got a lot of social justice type people who say CBT is gaslighting, So what's your take on CBT?
Okay, so I've been trained in 8 different orientations, and CBT was one. And the person who I trained under predominantly in CBT learned from, like he trained under Aaron Beck, the creator of CBT.
Wow.
Yes. So my lineage is pretty solid. Because a lot of my colleagues who, let's say, were more humanistic or psychodynamic, they hated CBT, but they didn't know enough about it. It just seemed, as you say, shallow, superficial. So they were going from, let's say, I think they were a bit prejudiced against it, whereas I was like balls deep in it, and I got to see all the limitations straight up. Okay. Or firsthand. So my thoughts on CBT, I say that CBT, and this is part of when I'm teaching about it, I do this long spiel. I won't do the long spiel, but in the end, when I'm lecturing to my students, I say, okay, and here's the final point of the story. And I say, write this down very clearly. I say, CBT is very effective for those for whom it's very effective. Okay. And I watch students, they're kind of like, some of them just writing down, they're not thinking, others processing, what did you just say? And I say, and that's a fact. If it gels with your way of thinking, if you're the kind of person, and by the way, I am, okay, I think about 5% of people can really do well with CBT, in the sense of, if someone says to you, hey, stupid, I mean, I'm being a bit harsh here. Okay. But this is wrong. What's wrong with your thinking? Smarten up, do it better. And they don't care about, they're not worried about the feelings being hurt or whatever. They just want a solution. All right. They want to be told, here's where the flaw is. Here's how you correct it. So someone who's like that, which I'm just estimating about 5% of the population, it works very well. Okay. Engineers love CBT because they're very,
Analytical.
very analytical in that regard, right? Logic based. So you tell them that, they go, okay, I get that. So CBT, by the way, it's not necessarily a problem of CBT. It's more of how it's administered. So I've had so many, and I alluded to this earlier. So I've seen many therapists, and again, I was working in a place where it was all CBT, and I saw the people training it, and I saw the people doing it, and I saw the shortfalls of it. Which is it basically, again, it assumes that this solution, this algorithm, works for everybody, regardless of who the person is, regardless of where they are. And there's a lot of shame in it, because CBT, the thing that made it unique when it first came out was, unlike every other therapy, where the presumption was that the magic works in session, right? The client-therapist relationship. That's where, that's where the change can happen. CBT said, no. It happens outside of session. You take what you learn and you apply it through homework. And so I saw so many patients, whether it was in my groups or others, actually my group was different, I'll tell you about it afterwards, but where they felt so much shame because they weren't able to, let's say, challenge themselves. If they had a phobia of elevators, they didn't do what they were supposed to do. They didn't 3 times a day go to an elevator and try to take it up, every single day. So they'd come back to group and they'd have to, report that they didn't do it. And I saw them get shamed. Well, if you're not helping yourself, how can we help you? Okay, these are the tools, you have to use them.
And so for me, I think that the idea that CBT is the problem because it's superficial is also a very superficial narrative. I tend to not agree, because I think you can be a fairly deep person and shoot for depth with people, regardless of the clinical diagnosis, and still use superficial tools. And I think back to what I said earlier about being a pragmatist, like living in Rehabistan, there's no amount of talking about your childhood that is going to get you to stop using drugs. I've been in Rehabistan for 15 years. Never once have I talked about their attachment insecurity, and that fixed it. Ever. I'm about as psychoanalytically minded as most people who do the work, but when you're faced with acutely ill people, all of that giving a shit about 0 to 5 goes straight out the window. Because you can certainly have pathological dependency issues and oral fixations, and those are all real concepts that are somewhat interesting and useful. But like, if you can't teach people how to increase metacognition and increase delay of gratification, I don't give a shit about your childhood. I just don't. I need you to learn how to regulate right now, so that if it is useful to talk about that, we get to that at some point. So I'm extremely biased because of Rehabistan, which is, I'm all about understanding the deep patterns of how you see the world and my countertransference and your transference, and I'm all about it. And all these psychological games that are worth exploring are useless if you're still high, if you're still psychotic, if you're still cutting yourself. It's all fucking useless to me.
You're going to recondition yourself. CBT is a lot about reconditioning. It's about reconditioning in a controlled manner where you are in control. You try to master some level of whatever you're dealing with, try to feel comfortable with that, build on that, and build on that success. It's systematic, it's methodical, and it does make sense. But you have to be able to get the person where they're at. And again, CBT kind of enforces where again, like I said, we're on session 3, we're at session 4, here's where you should be, rather than how do you get them to be in that place if they're not, if they're having a hard time getting there. So that's, I think, the flaw with CBT and the way it's delivered. And it just seems so mechanical. And as you said, it seems to be like it's more superficial, deals with the symptoms rather than the underlying causes. But in theory, CBT is supposed to get to those underlying causes. They do want to work with core beliefs, kind of rules and assumptions that you learned much earlier on and internalized and aren't even aware that you're following them. And it's supposed to help explore that. But it's done in such a mechanical way. And there's almost a placebo effect, because the person's being told, hey, if we just change this, or here's the problem here, here's your overly negative thinking, right? So if you just change this, you'll feel better. Blah, blah. And how are you feeling now? Oh, I'm feeling much better. Rate it. I was feeling 80 out of 100 distressed. Now I'm feeling 30. I must be doing better. Okay. So there's a bit of that going on. And hey, kudos. If it works to some degree. But it doesn't necessarily get to the really, really deeper issues, the unconscious issues. You can't just, CBT, interestingly, the whole point when Aaron Beck came up, like he was in a psychoanalytic institute, he was trying to basically manualize psychoanalysis. The core beliefs was supposed to be getting to the unconscious. He wanted to make a way so that a therapist could learn how to help patients step by step, get from the automatic thoughts, get from the conscious down to the unconscious. That was the intention. I don't think it really plays out that way. There are other ways to get that, because the the unconscious. You guard against it. Okay. There is some really scary stuff that people don't want to address. So to be able to get the person to feel confident enough, safe enough to go to the ugliest places of them about themselves, right? That takes effort. That's where you have to make them feel like, again, you're safe with me. I'm not going to judge you.
I think CBT is more effective for addictions than other issues. And I'm just from the work that I've done, you can explain things fairly simply to people. I don't want to sleep on the street tonight. If I use drugs, I'm going to get kicked out of my halfway house and sleep on the street. Therefore, I should not use drugs. Pretty simple, like if I want this outcome, I should do this behavior, not this behavior. REBT, which is similar, seems to be very good at analyzing relapses. I had these thoughts, these feelings led to this behavior, this consequence. It seems like even people who are not highly educated can understand this like simple line of logic. Does that resonate with you?
Definitely. I work with a lot of people with addictions, and I certainly do use, CBT principles with them. CBT in of itself is not sufficient. I think it's necessary, but not sufficient. I tell the patients with addictions, we do talk about this very logical, the action consequence and, trying to change that. I say the thing is what we have to understand, what we have to get to, I say is you understand that, you logically get it. So what is it about you, your programming or whatever that prevents you from acting on that logic? That's the approach I take. I say, and I go, we got to shift from this child brain into the adult brain. The adult brain is the CBT. I say the child brain is more the unconscious, the psychodynamic, the shame.